My name is Sam Benson, and I live in Walnut Creek, California. I'm a real estate broker. I specialize in residential real estate. I have my own company. My pain is hereditary. I played some sports, but that wasn't the cause of it. I have a degeneration of discs. For many years, I had epidurals, and they worked tremendously. I watched myself. I cut down on some activities that were compacting. I went to several different pain management doctors at the advice of my primary physician. Had 2 back surgeries, and then it was recommended by my pain management doctor that we take a look at the St. Jude device. After the procedure to where they inserted the leads and the implant, there was a few days, call it a week, I was sore, but the relief was immediate. The pain relief was immediate. I was given a choice of 2 different technologies with my neurostimulation device. One they call tonic, and one is burst. And the tonic is the old sort of electrical impulse, and the new one is burst. Bursts seem to have more of the biorhythms of my body. I hardly feel it. There are times I don't feel it at all, most of the time, as a matter of fact. It just makes it to where it's not a distraction. It makes it to where it mimics my body. My level of pain relief is much greater. You know how they do a scale from 1 to 10? I was a 6 to 8 guy, in and out all the time. My pain is now 2 to 4. There's days that I still take I take pain meds, but it's very infrequently. It's not distracting. You forget it's there. It's living life great. I went through the trial, and I knew immediately that it helped. I've had it for 8 months, and it's really made a difference. My endurance every day is much better than it used to be. We go places. I don't think twice about walking from where I have to park the car to where we're going, go to a baseball game. It's not a concern about walking to my seat or getting out of my seat. It's pretty much just taking for granted that I'm not going to be in pain, and I can do it.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. CE marking does not necessarily indicate regulatory approval status for all markets. Please refer to the instructions for use for a full listing of indications, contraindications, warnings, and precautions. RX only. Brief summary. Prior to using these devices, please review the instructions for use for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. Indications for use. Spinal cord stimulation as an aid in the management of chronic, intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications. Patients who are unable to operate the system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and medical screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy and case damage. Patients who are poor surgical risks with multiple illnesses or with active general infections should not be implanted. Adverse effects: painful stimulation, loss of pain relief, surgical risks, e.g. paralysis. User's guide must be reviewed for detailed disclosure.